Welcome to the Maine Health Center for Tobacco Independence Training and Education Team's additional media offering. My name is May LaRue, and I am the Program Management Specialist on the Training and Education Team here at the Maine Health Center for Tobacco Independence. For this quarter's Soundbite, we are going to be chatting about a topic many listeners said they want to hear more about: tobacco use and behavioral health. To help frame the conversation, we are going to first review some data to be able to fully understand just how pervasive the link between tobacco use and behavioral health really is, and how those with behavioral health conditions face many disparities because of it. According to the 2022 National Survey on Drug Use and Health, 18.1%, or 50.9 million people aged 12 or older, used a tobacco product in the past month, and 8.3%, or 23.5 million people aged 12 or older, vaped nicotine in the past month. Further, according to the same survey in 2022, adults age 18 or older with serious mental illness or any mental illness were more likely to have used tobacco products or to have vaped nicotine in the past month than adults age 18 or older with no mental illness. As you can tell, those with mental illness use tobacco products at a much higher rate than those without. Per the National Alliance on Mental Illness, or NAMI, 1 in 5 adults in the United States experience mental illness each year. Also, according to NAMI, those who smoke and have mental illness will die up to 15 years earlier than people without mental illness who do not smoke, and that the leading causes of death for those with mental illness are heart disease, cancer, and lung disease, all of which can be caused by using tobacco products. We know that people smoke for a variety of reasons: to celebrate, to grieve, to relieve stress, and to build community. Everyone's reasons are unique, but we know that those with mental illness may smoke at a higher rate in order to mask the uncomfortable symptoms of their specific condition. We also know that the tobacco industry has created targeted marketing campaigns toward this population, including giving away cigarettes to mental health facilities in the 1980s and 90s, and promoting harmful messaging such as quitting smoking will exacerbate symptoms of mental illness, and saying that using tobacco products will help these individuals relax and reduce stress. A research article from 2008 found that for those with schizophrenia specifically, smoking rates are extremely high at 80% of individuals with this diagnosis smoking, in that the tobacco industry worked to block smoking bans at psychiatric facilities. Oftentimes in our work on the training and education team here at the Maine Health Center for Tobacco Independence, we hear from healthcare professionals how difficult it is to know how to approach tobacco use with clients and patients because there is a misconception that there are bigger problems to address. As someone who works with those who use tobacco, you may hold this belief as well. You may think, quote, well, I don't have time to talk to my patients about their tobacco use because they're struggling with a heroin addiction, end quote. Or, quote, my client is newly diagnosed with bipolar disorder and learning how to manage manic and depressive episodes with new medication. The priority should be on that, not stopping smoking, end quote. Truth be told, however, we know that according to the United States Centers for Disease Control and Prevention, that cigarette smoking is the leading cause of preventable disease, disability, and death in this country. It is critically important to support all patients in quitting, even if you as a provider may feel that your work with a particular client should focus on other concerns. There is a misunderstanding in society that an individual working on their recovery with a different substance use disorder will relapse if they stop using tobacco products. We know that the opposite is actually true. Quitting the use of tobacco products helps those with other substance use disorder, achieve better recovery outcomes by an average of 25%. Of note, the main Quit link offers specialized support for disparate populations, including those with behavioral health concerns. Individuals with a behavioral health condition are eligible to receive 16 weeks of free nicotine replacement therapy through the Quit Links program. Providing individuals with the support they need is key to tobacco use recovery, as many individuals with behavioral health conditions and substance use disorders want to quit smoking but don't know how and don't know what resources are available to them. We encourage you to visit the North American Quitline Consortium website to learn about your state's Quitline offerings. I also want to make you aware of a RAT card that is available on the Maine Health Center for Tobacco Independence Tobacco Treatment Material Database. This RAT card, titled Addressing Tobacco Use in the Behavioral Health Population, is available for digital download or for print ordering. We also have a dedicated tab on our website for behavioral health providers, which is linked for you in the description of this video. On the page, you will find various toolkits and treatment tools that you can use in your tobacco treatment practice. That is all we have time for today. So in conclusion, I want to thank everyone for tuning in and listening to this soundbite about tobacco use and behavioral health. Next quarter, we will have a very exciting guest joining us, so I encourage you to mark your calendars for the episode coming later this summer. I'd also love for you to share what you'd like to hear about in the next soundbite. Please don't hesitate to reach out to the email on your screen and let me know what topic you'd like me to cover next. Don't forget to visit our website at ctimaine.org to learn more about the offerings of the CTI Training and Education Team. Take care.